Prostate cancer is the most common male cancer worldwide, with 1.4 million men diagnosed in 2020 and 375,000 dying from their disease. Imaging scans are used in detecting and characterizing disease to guide patient management and enhance treatment. Prostate-specific membrane antigen, PSMA, is a cell surface transmembrane protein that is overexpressed on the surface of prostate cancer cells, with expression further increasing on metastatic prostate cancer cells. As it is low or absent on healthy cells, PSMA is an ideal target for accurate prostate cancer imaging and has been a major development in prostate cancer diagnostics and therapeutics. A PSMA targeting agent named PSMA-11 is labeled with the tracer gallium-68, creating a molecularly targeted radiation product. This is prepared using the Illuccix kit. Gallium-68 gazettatide, also known as PSMA-11, is then intravenously administered into the patient's arm. Upon encountering PSMA-expressing cancer cells in the body, PSMA-11 targeting agent binds to its target with high affinity, while gallium-68 is a positron-emitting radionuclide that is detected by a PET scanner, revealing the distribution of cancer cells in the body. PET imaging with gallium-68 PSMA-11 has been proven highly specific and sensitive in clinical trials. Illuccix is indicated for men with prostate cancer with suspected metastasis who are candidates for initial definitive therapy, for patients with suspected recurrence based on elevated serum PSA level, and for selection of patients with metastatic prostate cancer for whom lutetium Lu-177 vipivatide tetraxetan PSMA-directed therapy is indicated. Illuccix harnesses the power of PSMA PET imaging to help make a difference in the lives of patients. Illuccix Pharmaceuticals. See it, treat it. Indications and usage. Illuccix, after radiolabeling with gallium-68, is for positron emission tomography, PET, of prostate-specific membrane antigen, PSMA, positive lesions in men with prostate cancer, with suspected metastasis who are candidates for initial definitive therapy, with suspected recurrence based on elevated serum prostate-specific antigen, PSA level, for selection of patients with metastatic prostate cancer for whom lutetium Lu-177 vipivatide tetraxetan PSMA-directed therapy is indicated. Important safety information, warnings and precautions, risk for misinterpretation. Image interpretation errors can occur with Illuccix PET. A negative image does not rule out the presence of prostate cancer, and a positive image does not confirm the presence of prostate cancer. Gallium-68 gazettatide uptake is not specific for prostate cancer and may occur with other types of cancer, as well as non-malignant processes such as Paget's disease, fibrous dysplasia, and osteophytosis. Clinical correlation, which may include histopathological evaluation of the suspected prostate cancer site, is recommended. Imaging prior to initial definitive or suspected recurrence therapy. The performance of Illuccix for imaging of biochemically recurrent prostate cancer seems to be affected by serum PSA levels and by site of disease. The performance of Illuccix for imaging of metastatic pelvic lymph nodes prior to initial definitive therapy seems to be affected by Gleason score. Imaging to select patients for lutetium Lu-177 vipivatide tetraxetan therapy. The interpretation of Illuccix PET may differ depending on imaging readers. Illuccix PET interpretations to select patients for lutetium Lu-177 vipivatide tetraxetan therapy may be more consistent when judging gallium-68 gazettatide uptake in any one tumor lesion compared to judging uptake for all lesions larger than size criteria. Multidisciplinary consultation to select patients for lutetium Lu-177 vipivitide tetraxetan therapy is recommended, particularly for Illuccix imaging that a single reader finds borderline or difficult to interpret, or when patient eligibility hinges only on judgment of gallium-68 gazettatide uptake for all lesions larger than size criteria. Radiation risks. Gallium-68 gazettatide contributes to a patient's overall long-term cumulative radiation exposure. Long-term cumulative radiation exposure is associated with an increased risk for cancer. Ensure safe handling to minimize radiation exposure to the patient and healthcare providers. Advise patients to hydrate before and after administration and to void frequently after administration. Adverse reactions. The safety of gallium-68 gazettatide was evaluated in 960 patients in the PSMA pre-RP and PSMA BCR studies, each receiving 1 dose of gallium-68 gazettatide. The average injected activity was 188.7 plus or minus 40.7 megabecquerels, 5.1 plus or minus 1.1 millicuries. The most commonly reported adverse reactions were nausea, diarrhea, and dizziness, occurring at a rate of less than 1%. In the VISION study, 1,003 patients received 1 dose of gallium-68 gazettatide intravenously with the amount of radioactivity 167.1 plus or minus 23.1 megabecquerels, 4.52 plus or minus 0.62 millicuries. Adverse reactions occurring at greater than or equal to 0.5% in patients with metastatic prostate cancer who received gallium-68 gazettatide injection in the clinical study were fatigue 1.2%, nausea 0.8%, constipation 0.5%, and vomiting 0.5%. Adverse reactions occurring at a rate of less than 0.5% in the VISION study were diarrhea, dry mouth, injection site reactions, including injection site hematoma and injection site warmth and chills. Drug interactions. Androgen deprivation therapy and other therapies targeting the androgen pathway. Androgen deprivation therapy, ADT, and other therapies targeting the androgen pathway, such as androgen receptor antagonists, can result in changes in uptake of gallium-68 gazettatide in prostate cancer. The effect of these therapies on performance of gallium-68 gazettatide PET has not been established. Please note that this information is not comprehensive. Please see the full prescribing information at illuccix.com/prescribing information. You are encouraged to report suspected adverse reactions of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. You may also report adverse reactions to Illuccix by calling 1-844-455-8638 or emailing pharmacovigilance@telixpharma.com.